Hello?
Hey, John. Can you hear me?
Yep. Is that Matt?
It is. How are you doing?
Good. How about yourself?
Yeah, not bad.
That's good. That's good. Everything treating you well?
Yeah, looks like you're in the office, though. I thought you'd be at home.
No, I'm in the office. Yeah, I've been working for the last 2 months, almost every day.
Well, I figured you were working. For some reason in my head, you were doing it at home.
No, probably, I'd say about, most of the days. Yeah, I'm here most days. Yeah. Jen has a different schedule, the clerk, but I get more done, I think, here.
I can almost guarantee you that.
The kids are home, so you know what that's like.
Yes.
So nice day today, huh? Jeez, good day.
That's crazy. Especially when didn't it snow like this weekend, last weekend or something like that?
Yeah, it was kind of strange. It's hail. The other day we got a bunch of hail over here.
Yeah, and now it's like 75 or whatever.
Yeah, hopefully it destroys some of the virus. As a virologist, you're probably saying, really? Did he really say that?
It's fine. Just keep hoping.
That's right.
Hi guys, John, how's it going?
How you doing, Karen?
I'm only on here. Hi everybody. I'm only on here to make sure the Zoom is working properly.
Oh, Jaikar's here.
Yeah, so everyone's joining. There isn't an issue, right?
Matt's here.
Good.
We've got
let's see. We have you, Jaikar, Matt, Sophia, Delalio, and
yeah. Waiting for Kathy, the chair.
She'll come. She always comes.
So this is recording right now, right?
I hope everybody snuck out for a few minutes today. It's beautiful out.
Gorgeous.
Yeah, it is.
I was able to go outside today for some soils.
Yeah.
Witnessing soils, but this is recorded, right?
Yeah, it's recording right now.
Okay. To let people know, we're recording.
Yes.
So,
yes. You're recording. And if you haven't done this before, probably most of you have, but if you haven't, the best bet is to put your, put it on mute when somebody's speaking and only unmute when you have something to say, because sometimes the background noise makes it very difficult to hear. That's my advice.
Yes. And so at the end of the meeting, Karen, it's just when everyone signs off, it automatically closes it out. So,
yeah.
So what happens if there's someone on there that decides to, like, a few? I'm just hypothetically speaking.
Like a crasher.
Decide not to sign off. Can they
since I'm the one that hosted this one, and I won't be the one that hosts going forward, but the host can has the ultimate power to shut anybody off they want. So basically when the meeting is over, I'll come and hit end meeting and then it's just over. It stops recording and it's done. But I'll wait till I see that you guys are off. But going forward, you'll be the host, John. I think we'll set you up.
Yeah.
It depends on, it depends on how long we're doing this, but it looks like it's going to be a while. I don't anticipate having real meetings in the building for a bit of time.
Yeah. Well.
And I know we're trying to reopen here. I have two girlfriends that both work and that are both, one's a nurse, one's a PA, and they were telling some very sad stories when I was talking to them today. So there's still a lot going on right now, unfortunately.
Yeah. Hopefully we get a little bit of a reprieve in the summer.
I hope so.
I don't know what's in store for the fall. So hopefully we.
I don't know. The unfortunate part too is they said, I know one of them, she was really upset because she had to intubate a 20-something-year-old pregnant woman who was 6 months pregnant yesterday. And the other one just lost one of her nurses who's only 51. So it's, they're still getting hit, which is scary, but.
Indeed.
Oh, there's Kathy. She's on. Let's see.
You're on, Kathy?
I'm
Kathy,
here.
can you hear? All
Yeah,
right, and I think you're mostly everyone is here. Hi, Kathy. I'm gonna shut everything down here, but I'll keep peeking in and seeing how it's going.
okay,
But
thank you.
John, you have my cell and Kathy, so if anything's crazy, and I'm just on the other side of the table, please text me. All right, good luck, guys.
Thank you.
Thank you very much. Okay, so obviously this is a new type of environment, a Zoom remote meeting. So I guess we handle it as a normal meeting, and Kathy, you're the chair. If you wanted to start, open the meeting and go through the agenda,
Okay,
feel free.
I make a motion, we open the Board of Health Zoom meeting for Thursday, May 14th. Do I have a second?
Second.
All in favor?
Aye.
Aye. Jagger, you have to unmute to say aye.
Aye.
Good. All right. We wanted to keep you guys updated on what's been going on, so do you want to, since Melissa's here, John, do you want to have Melissa review, do her part so she doesn't have to wait for the whole
Yeah.
Excuse me 1 minute, Kathy and John.
Yeah,
I forgot to tell you, so you have to treat this almost as if it's executive session for your votes. So you can't just vote second. You have to actually poll the board
okay,
for every motion, okay?
okay.
That's
So
all.
I'll do it again. I make a motion, we open the
Thanks,
board.
sorry.
That's okay. Make a motion, we open the Board of Health meeting for Thursday, May 14th.
Second.
Matt, you just say yes.
Yes.
And then Jagger
Yes.
and Kathy Lannon, yes. So now it's officially opened.
Okay, so I guess you had mentioned, Kathy, you wanted to maybe go down to the Emerson Place project, since Melissa's here to go over just the general update. And
Great.
the EIR peer review, just a general update on that.
Sure, I can give a brief description of our review letter. So for the record, Melissa Ricas with Beta Group. We did peer reviews for this project for Planning Board, Board of Health, Board of Selectmen, and the Conservation Commission. It's been at least a month ago now, I think. And I know that Dan Merricken has been working on all of our comments for all the various boards, and he indicated that he's going to be addressing all the comments and coming out with a new set of plans that addresses our comments, hopefully to our satisfaction. And he's going to do a presentation on that at your next meeting, I believe. So the biggest concern that we had kind of across the board when we reviewed the site is that a lot of the infiltration basins, some of them didn't have test pits completed within the footprint of the basin. There's also a lot of wetlands around the site and high groundwater. And when we went out and did a site visit, we looked at each of the basin locations and we just kind of did a hand auger in the field. And we were seeing some indicators of models and groundwater higher than what the design report had indicated in some of the basin locations. So one of our biggest comments was to go do additional test pits in the field and confirm and have a representative from the town. I believe John was out there today and they were doing some of these test pits and he was out there with them. So I'm not sure what the results of that were. Obviously John was out there today, and whatever they talked about and found in their soil evaluation today, Dan said he would take it back to the office and he would incorporate that into the drainage report, revise calculations and design if he needed to. And then he would update the plans, updated the drainage report, and provide us with an updated report next week to try and address those issues.
Yeah, as Melissa said, I was out there today with Dan, and as a rundown, quick summary. The plans, again, all the information is on the Dropbox if you haven't been there for the Emerson subdivision and stormwater, preliminary stormwater plan, and the EHIR peer review. But as a rundown for the soils today, Basin 4, I'll just run down. Melissa probably knows more about this than any of us. Basin 4, 3 holes at 5.5 feet groundwater below grade. Basin 3, 2 test holes, 8 feet below grade groundwater. At Basin 5, 2 more test holes at around 4 feet below grade. Basin 6, which is the highest, which didn't surprise me, was 2.5 below grade. I think that's the nearest towards the farm.
Okay, yeah, that would make sense. Yeah.
The horse stables and so forth in that direction. So that's what was there today. So they'll probably adjust those calculations on those numbers. If you don't know about it, Melissa, correct me if I'm wrong. It's like a 42, 43 lot subdivision, 15,000 approximately square feet each, somewhere in that direction. Town water, town sewer, and obviously an EHIR needed.
Right.
So Melissa, how many actual basins are there in the plan? 4?
No, I believe there's 6.
6? Okay.
And they're kind of spread all throughout the development there. So some of the comments we made are that they're working out, and I think they have to go back and revise they're going to have a homeowners association associated with the site for the long-term operation and maintenance of the stormwater systems. And they had some language in there about, because the roads will be turned over to the town, and the town will maintain the roads. And I think the homeowners association will be responsible for the basins, the maintenance of the basins. They need to work out some details with DPW on exactly what those limits are, and they have a couple structures they were proposing, like a storm scepter type structure in the roadway that I don't think DPW wants to take ownership of. So there's some things to work out there that I think they're working on now with those details of the homeowners association documents and who's going to be responsible in the long term for those components. They are asking for the waivers that are typically asked for in the EHIR review about the, neither increase nor decrease in volume off the site, and the slope of the bottom, having a flat bottom dry basin, which the board has typically granted in the past. And they need to provide some more details we asked for on some of their crossings. They have a few culvert crossings. They're existing kind of like cart paths with, I think they're corrugated metal pipes or concrete pipes that they're kind of upsizing and for their roads. So they need to provide some more detail on that.
Melissa, have they been through the Concom yet?
They had one meeting with the Concom. I believe it was just kind of an initial presentation to the Conservation Commission. They haven't responded since we made comments. They haven't been back to the Concom since we made comments.
So essentially the wetlands haven't been delineated by the Concom yet.
So it was delineated a few years ago, because this project, I guess, came in front of the Concom for the delineation, and it had, I believe, either expired or it was close to being expired as far as the wetland delineation line. So in the past couple months, they went back out, they redelineated, and Beta was out there with them. They were kind of going back and forth on moving some flags around and, finalizing the lines, because they did change a bit. I don't know. Actually, I don't think it could have been approved yet, or I think they're working through that with the Concom right now.
Okay. And
But
where are
they were staying pretty far out of the buffer zones.
Yeah.
So there might be some, I think there might be some impacts of changes to the bank and what they're calling the stream, intermittent versus perennial and things like that, that might affect the actual crossings. But I don't think that the wetland lines will change, you know, where they're putting roadways or buildings or anything like that.
Where are they with the planning board?
Planning board, they submitted, you know, we did our initial comments. They did have a Zoom meeting on Monday, but it was strictly in regards to traffic, and they were just doing a traffic presentation. So they're kind of at the same point. I think he wanted to get Beta's review comments, revise his plans before they came in front of all the boards, you know, to kind of get those details worked out with us. And squared away so they could kind of have some more meaningful conversations with you guys.
Okay.
So.
Does the board have any questions?
I don't. This is Jaikarr.
I don't either.
So we just have to wait for the more information to come in and the revised plans.
Right.
Great. So that's it for Emerson Place. Are you looking at any of the projects just while we have you?
There's nothing under design review other than this one at the moment. We're kind of checking in on the various construction projects that are under construction. Glen Ellen, there hasn't been anything for us to go out and, you know, as far as drainage and infrastructure work over the past month or two really, but we went out last week and just kind of drove around, took a look, touched base with them. They said that they might have some drainage work starting next week, that we would go out and do observations for. I did have a question in regards to that with the Board of Health. You know, Beta, we have a COVID field plan for any of our employees who are doing field work, going out in the field. And I have that outlined, and I can provide that to you, or if, I don't know if anybody is interested in that in the town or wants it, or if you have any particular requirements that you want to share with me or want me to incorporate into our plan when we visit Millis in particular. But I can see that I think the contract work is going to start to pick up in the next couple weeks, and we'll be, you know, starting to make some site visits.
Yeah, Melissa, this is John. Yeah, if you want to send that plan over, that's great. We do have a plan that Toll Brothers instituted down there for their work. I was just there yesterday, actually, looking at it. And they have a protocol for testing employees, contractors coming in, hand washing areas and signage and so forth. They seem to be doing pretty well. That's what they told me. And they have a environmental firm, a health and safety firm that's overseeing their project, their COVID construction plan. But yeah, if you do have your own plan that you want to send over for data per se, that's fine. If you want me to review it, ours mostly is concerned with the construction activities, but
Okay.
you know, obviously, you know, from your standpoint, it's more internal to your organization.
Right. Yeah. It's just, it's Beta's requirements for our own employees and just what we do when we're out there. And, you know, we're just want to make sure that
Yeah,
you're comfortable with us, you know, what we're doing, and it's in line with what you'd expect. I think it would be. We kind of take, because we have offices in different states, so we just kind of take the most stringent of all state requirements and put it into one plan that all Beta employees follow. So there might even be extra in there. But
That's fine. Good.
okay, I'll send that over to you, John, just so you have it in case you want it. But I think that's it. It's been kind of a little quiet over there in Millis for us lately.
Thank you.
Mhm.
Thank you, Melissa.
Okay.
Thank you, Melissa.
Yep, no problem. Good to see you all.
Stay safe.
You.
You.
Before we start with Emily, otherwise known as Sophia,
Yeah. My kids own all of my.
we do have someone on listening, and I want, if it's something short, do you want to offer them the opportunity to speak? So it's Donna Roach. So Donna, if you have a question, we don't want to keep you waiting too long because we're going to be going over COVID, which will take a while. No reply? Okay, so do you want to do COVID next, John? So we don't keep Emily waiting?
Oh, yeah.
Can I introduce the board to our public health nurse, who's been very, very busy? This is Emily, Jakar, and Matt.
Hello.
Hello.
Hi.
Hi.
Let me just, if I could, just interrupt for briefly. That I've said this before, and I know that it's like a broken record to Emily, but I remember when she first took this job at 10 hours a week. I said, after flu season, it's really, there's nothing going on, so don't worry too much about it. You'll have plenty of time to just do independent projects if you feel as though you need, and collaborate with the schools and this and that. And she's probably thinking, really? Big time.
Well, global pandemic, yeah, you can't really make this stuff up, right?
We're glad to have you.
Yes.
No.
Yes.
We're glad to have you. Glad to have you.
Yeah.
Don't get taken by any other towns.
Yeah. No worries there. No. No, yeah, it's been very busy, but lots of support. Yeah, you couldn't really anticipate this was going to be where we were at this point, but here we are. So what do you want me to start with first?
I don't know if you wanted to run down the COVID report, the nurses report, maybe just brief.
Yeah, so I ran the report yesterday. The Maven system was down this morning, so we couldn't get on for Maven. But last count in my head, and Kathy, you can correct me, I think we have 46 confirmed cases. Confirmed probable, I should say. And I think we have about 60 plus contacts as well. That we have followed or are continuing to follow. And we've been really actually successful contacting a majority of the cases. We have not run into many issues of people not responding to us. It takes a little investigation here and there, but we've been able to get in touch with almost everyone, really. And we've had, very positive response. People are very, once we tell them kind of who we are and why we're calling, then they're very open to listening and following the quarantine and isolation. So we haven't run into, we've heard, Kathy and I, and John probably too, are on calls, you run into some issues, but we've been able to contact
Llama
them.
picture didn't show up.
All of the cases, really. So that's reassuring that we're capturing, anyone in the town that might be a contact or positive. And yeah, so we've just been doing, so every week I have, you know, weekly phone calls with MDPH, MRC, different local boards of health, and then the Mass Association of Public Health Nurses. So we're all collaborating together, because what's been happening is, as we're all seeing in all of our different facets of life, things are changing constantly. So I feel like very supported, knowing that the information that we have to give to our community members is the most up to date, and people are working really hard to give us the guidelines. And but that sometimes comes with a little struggle too, because people, you know, you tell them one thing one day and then you call them back the next day and it's changed. But so we're connected in, you know, getting all the latest information for the context. So because I've been really busy with contact tracing and following cases, I haven't, that's kind of where I am now. Kathy and some of us have really started to kind of think about the fall and what our flu clinics might look like. I don't think we know for sure exactly what to expect. I've been hearing a lot on phone calls, you know, drive-by type situations, things of that nature. So we'll have to just keep, you know, it's hard to plan ahead when we don't know what's going to be happening, you know, even tomorrow, really. But yeah, I think I was looking at the, because the state now releases the numbers for all the communities. It's interesting, in our areas, the surrounding towns, it seems like statewide we had a little bit of a dip, but in our communities, it seems like it went up a little in a lot of the towns, which I thought was interesting when I looked at the data. But I think, you know, we're pretty consistent with towns of our size. But yeah, anything else, Kathy, you think I should add?
I think one of the reasons that's happened to us in the last 2 weeks, Emily, is it?
Yep.
All of the cases we've had have been frontline workers.
Correct.
So to us, that shows that the stay-at-home process is definitely helping. And I think the reason we might have been a little higher in the last week or two is because there was a movement by the state to get all nursing homes, extended care facilities tested. And so a lot of our cases were related to employees testing positive.
Right. I also think we might see a bit of a jump. The new recommendation is all household and close contacts get tested, which was not what was being guided initially. So, you know, doing this contact tracing, Kathy and I probably, you know, there's family members that potentially could have been positive but never got tested, either because it was way back in the beginning when testing was much more difficult, or you know, they just didn't get tested for whatever reason. But now the recommendation is, if someone's positive, we're recommending that everyone who's their close contact also get tested. And so we might see more household members have positive cases in that situation. I think pediatrics is kind of coming into the forefront now with some new, you know, things that they're seeing. So I believe pediatricians are probably going to be more open to testing, especially those close contact pediatric cases that, you know, their parents or grandparents or whoever they live with is positive. Whereas before, pediatrics kind of seemed like a little less involved in the testing. So we might see more kids being tested now as well. So all those things could play, and we don't know, you know, at the May 18th, whatever comes out, as people come out into the community more, of course, we can be prepared to maybe see. But like I said before, you know, kind of being in a smaller community, I feel actually really lucky. We have really good relationships with our cases. We are able to contact them very frequently throughout the whole quarantine and isolation process. So we feel confident that they're recovering properly and that their family members are not getting sick. So to me, being in a small community in this pandemic situation is actually a very positive thing. And like I said, we've been able to really connect with pretty much all of the cases, which is another good thing. We don't lose someone that might be not isolating or quarantining if they need to be.
I think the issue that we're dealing with now, just to make you guys aware, the state currently, the guidelines are that if you test positive, the minimum amount of time that you stay home, they call it isolation, is 10 days. The contacts, the people that live in the household, their requirement to stay home is 14 days. So they stay home longer than the actual contact in some cases. So what we're seeing with some of the cases is some employers have been requiring that they test negative before they go back to work. And just so you know, because the actual test for COVID, even though it's very sensitive, people can continue to test positive when they've been clear of symptoms for weeks and weeks. I think our longest one is like 5 weeks, Em, or 6 weeks.
6, I think, 6
6
weeks now.
weeks, even
Fully
though
recovered.
we know they're totally recovered. So the next thing guidance we're looking from the state and nationally is to rethink doing, making everyone test negative before they go back to work. We've actually had instances where people got a positive test weeks after they finished with us. So, if they didn't get tested, they'd be done. But since they got tested, we're kind of in a intermediate area where the state's saying, call them and tell them they have to go back into isolation, which if they don't have symptoms. So we're hoping that issue will be resolved before there's more opening.
There's another group too that has now come out. If someone does get the antibody, the serum blood test, we are considering them a case. And that's been a little more challenging to follow in some regard. So the recommendation now is if anyone gets an antibody test, they really want the provider to also write the order at the same time for the PCR nasal swab, because that's really going to show us, is this person actively, or was this really truly months ago? Where are we? So we can actually maybe isolate or quarantine cases that could potentially still be spreading, even if they got the antibody. So that's new as well. So those would be counted. I don't know, Kathy, if that's the probable cases will end up on the weekly report, but they can be considered cases at this point.
So, Kathy, were you saying that people were having a positive PCR test 5 weeks afterwards?
Yeah.
You betcha.
I was speaking to a nurse. I was speaking to a nurse in a local community about COVID-related situation, and she says she has a case that's been testing positive, totally recovered for about 4 or 5 weeks, but it's been 8 weeks since the first initial positive test, but no symptoms. Has been.
So do we think these people are shedding virus then?
No.
No. They believe that the test can pick up dead DNA fragments in the nasopharynx, and some people, and Kathy and I were talking about this last night on the phone, it doesn't seem to correlate with, someone who's really, really, really sick tests positive for a really long time. We do have some pretty asymptomatic patients who have very, very limited symptoms, and the only reason they got tested was because of a known exposure or a workplace requirement, and people with very little symptoms are still testing positive, but the state is not considering them shedding virus or contagious that far out.
Right. So have people, sorry, I'm a scientist, I ask a billion questions.
Yeah,
so
no,
have people actually done experiments to show that these are not like low-lying replication events? It just seems unlikely that an RNA virus would have its nucleic acid stick around that long after an infection and not have some sort of low-level replication occurring.
We're waiting anxiously for that answer too, Matt.
Okay, so no one knows then.
No.
I don't know a whole lot about this. It seems like you would assume these people are shedding virus. to some level.
The state really,
But
the
I don't know what
the epidemiologists, I mean, we're kind of in a double standard situation, because if you didn't get any testing post illness, you know, they're done in 10 days at a minimum. So I, you know, this is something we're hoping they'll get some answers for soon, because it's confusing for us, and it's confusing for the people we call to call back and say, you know, we don't know, we don't know what to do about, you know.
So did people see this with other coronaviruses in the past? Is that known?
I don't know. I'll have to look that up.
Yeah, I'm not sure about that. I think when we initially started the isolation and contact, the cases would be in isolation for 7 days. Now they're pushing it back to 10. I do think that they're looking at that. It seems to be something that can shed for longer than maybe, I don't know about the other coronaviruses, or but the state has looked at it, and so we were in the beginning advising people based on the state guidelines to stay home for 7 days and monitor. Now it's 10. Who knows, that could change to 14
Sure.
with more data. I think it's something that they're really looking at. I think initially the CDC was endorsing and recommending testing to get people back to work, especially these long-term care facilities, because they didn't want to spread it any longer. Yeah. Now the CDC is not recommending testing to end isolation or return to work. Instead, they are much more suggesting better, you know, hand washing, wearing a mask at all times when you return to work, things of that, because I don't think they know for sure. But it's really, Kathy and I have had so many conversations about how interesting that some people are really truly fully recovered, and you know, 6-7 weeks later are still getting a positive.
Yeah, I mean, I guess it's possible. I'd have to see the data, obviously, but it could be that. So if you, I don't know if you guys have ever run PCR, but like you can have a really positive because it comes up very early, or like it's positive but it's really low, and maybe these people are shedding. But they're shedding like 10 particles a day or whatever. And like, it just doesn't matter. Like, you wouldn't know that if you couldn't look at the data. So I guess it could be really either way.
Let me just add that when they say shedding, or they have positive PCR, it's non-infectious at that stage, right? That's what they're assuming, is that
I think the CDC is assuming that, or they wouldn't have been pushing not to test.
Because what they probably could do, just thinking about it, is get somebody that's presumably over it in the household, and that someone who recently was you know, close contact in there with, it overlaps the quarantine time period where they're over it and they're presumably shedding, and see if they're in the same household for a certain period of time. If they do contract it and they can guarantee that they haven't been out anywhere else, this is transmissible, even though they're saying that it's just positive, but no transmission taking place.
Yeah. One of the things we've seen, John, is in terms of the contacts that do get symptoms in the, you know, that we clearly think it's from the household contact, it's the 3 to 5 days really seems to hold true, that the household contacts who do get symptoms do get them within 3 to 5 days of you know, of the person, the positive person. So I don't think, Emily, we haven't seen anyone turning positive like 2 weeks later.
No.
In any of our contact follow-up.
Yeah, I always kind of breathe a little sigh of relief around day 6, especially if it's a high-risk household contact. If they hadn't started to develop symptoms by day 6, I don't hold my breath totally, but I definitely feel more reassured that person will most likely stay healthy. Because we've had a couple of more high-risk household contacts that we definitely worry more about. We've had households where someone is positive and the contacts remain healthy. And that's, you know, because they're doing a really good job isolating at home. And it's a big, you know, I think again, circling back to being in a small town, I like the fact that we can connect with these individuals at least. We try to do it, at least every day, because it's hard for a lot of, they worry too about their family, and they hear all this on the news, and it's really hard. But no, we haven't. If someone's going to get it, we usually see them calling us, within the first 5 days to say, oh, my husband's sick, or my boyfriend, or whatever it is. Yeah. But they do write out that 14-day quarantine, regardless of when they develop, if they still stay healthy.
So let me just ask a question. The difference between when you have positive, you get 10 days, and the quarantine's 14. Is that they're assuming a 4-day incubation period? Is that how they're interpreting that? So that's their official. Because I was always hearing sometimes in the past it was 2 weeks and then a week. So they're comfortable with 4 days. Maybe I'm reading it wrong, but that's the way I'm seeing
that standard hasn't changed, John.
Yeah.
There are many things we can say haven't changed, and that's one of them.
Yeah, I think that's the only thing. I think that might actually be the only thing that hasn't changed.
Well, no, the close contact being 15 minutes
or
longer with less than 6 feet. That's the other one that hasn't changed.
Yeah.
And just for you guys' knowledge, one of the things early on we were saying is the sudden loss of taste of smell. We were seeing that in cases where sometimes that was pretty much their only symptom. So we were very happy when that got added to the symptom list, because what we've seen is the sudden loss of taste to smell tends to be the younger people that have minimal symptoms. So that's important for everyone to know in terms of family and relatives, that there's really no other reason you suddenly lose taste or smell. I mean, in the old days that meant a brain tumor, but now
when you say younger, do you mean like adolescents and younger, or you mean younger
no,
than
I mean
50?
I consider you gotta consider. Yeah, I consider it anyone under 40.
Okay.
Right.
Yeah.
So, so a couple of things. Brigham and Women's, and I'm sure you guys know this, has a site that is from Johns Hopkins has stated that it's their gold standard in terms of keeping track of evolving symptoms, as well as what they're telling healthcare workers on the front line to look for in treatment standards. And they update that every day. So one of the things they just updated this past week was they are now considering within their 75,000 employees, if someone registers, they have a process where every morning, every employee registers onto a website and says, do you have any of these symptoms? They've just added a stuffy, drizzly nose and sore throat. So if you have a stuffy, drizzly nose, you, according to Brigham and Women's, which again is this gold standard, says, please don't come in, and keep logging in with us, because this is now one of our accepted standards, accepted symptoms for COVID. Yes.
We're glad to hear.
Go ahead. I'm sorry.
I'm sorry, Jackie. We're very happy to hear that, because Emily and I have noticed that, again, the younger, very minimally symptomatic people, we can hear it on the phone. They'll say, they'll say, you sound a little congested. Yeah, I am.
Right.
And that could be their only symptom. So that's something we've been following all along.
Yeah.
Yeah.
The other, it's, and the other thing that I'm responding to Matt in terms of, did any of the other novel viruses have, kind of this lingering, is it, are you infectious still, et cetera? From what I've read, and again, I'm reading Johns Hopkins, this Brigham and Women's, and I forget one other, WHO, say this is different, because these positives are registering so far out that none of the other novel viruses registered positives this far out. So, and that they don't really understand why that's so, in terms of, are those people still shedding? Because like you said, it is still intact. There's enough intact to register a positive. They don't know. And they don't, and so they're studying that over in Seoul and in Germany, actually, at this point, because they've had this resurgence of people who were supposedly cleared and then came back weeks later testing positive, sometimes with symptoms, sometimes not. So I think that goes in the bucket of don't know yet, don't have enough information. And I think, you know, one of the things that's hard for me as someone who likes systems, and as an architect, you have to, you know, everything's about systems, is there's no continuity of protocol. And so you're always measuring apples and oranges and apples and oranges. And you know, it's literally from town to town to town, even within a state, that it's different. So I think it's going to be really hard until we figure out some sort of baseline. We all do this, and then, you know, if this happens, we all do that, because otherwise the data is in some ways it's interesting, but I don't know how useful it is, because it's not consistent in terms of benchmarks.
I
You
think
know,
they'll
so
check off every town in terms of follow-up. We're all following the same system. It's all the state surveillance system in Massachusetts.
in Massachusetts, right?
Right.
But right.
I don't know about other places.
Right. And John, I keep thinking of what you said the last time we met physically, which was, you know, this is the ghost of not having a universal public health system in this country. You know, it's just, you know, and people are actually starting to understand that. People are, you know, that I talk with in different states, different kinds of communities, you know, metropolitan, dense metropolitan, people are getting, you know, yeah, in this state, but a significant number of people travel between states for work. So, you know, so then it's like, which protocol are you bound to? The one that your work where you work, the state where you work, or the state where you live, or I just think this is, you know, it's making things much more difficult for a virus that's already very challenging to figure out. So, so I just, you know, every day, like you said, every day it's like, okay, so what's the headline today? Is it the opposite of the headline yesterday? And sometimes yes. So I really applaud the people that are in there, you know, working this system. Thank you both, of trying to navigate, you know, shifting sands, and you know, trying to keep people healthy, and as well as the community healthy. So thank you.
And just so you know, we also have a school nurse that's helping us. There's 3 of us.
Oh,
so
great.
She's doing a great job. We'll have her until whenever the school would have gotten out. And we do have a senior volunteer who's a nurse who's done the training. And we're hoping that come June 15th, we'll have her to help us. You know, you've been hearing about the state COVID task force. We haven't utilized them because we haven't felt the need. And we think that they should be focused on the densely populated areas where the follow-up's been nowhere near as good. I saw on TV that their follow-up rate was 50%, you know, contact rate.
Yeah.
Ours is closer to 90%. So, and we found that it delays our follow-up for a couple days. You know, that we're quicker at getting to people. So for right now, Emily and I would like to keep it that way, that if we need them, we'll call them. But, you know, we're doing an okay job because of our population size with the resources we have.
So the governor's opening things up the 18th, right? Is that the last thing I've read? John, do you know if there are any towns that are considering, I don't even know if they can even legally do this, but continuing like a lockdown in their town?
That's a good question. I'm not sure the legalities of that. Yeah, I think because it's a commerce issue, it becomes a state issue as far as most commerce matters. So I'm not 100% sure. Not being an attorney, I couldn't answer that directly. But again, on the 18th, we'll find out more. My guess is that and I'm just guessing, is that there's a phased-in plan. I think there's 4 phases apparently, from what I'm gathering, and it's tiered in risk. So the lower risk in phase 1 opening, and then see how that goes, see where the numbers go, and then phase 2 moderate risk, and then phase 3 higher risk, depending on how these numbers go. Now, obviously, we've seen a decline in the hospitalization. The trend has gone down in the last 2 weeks or so, but they don't want to see it pop back up again for obvious reasons. And again, some of the states are opening up their doors, so to speak, and it remains to be seen. There's a lag time. I think you get a lag effect of probably a month before you find out what the policy does or what it did. So, what you do in the beginning of June, you won't see the ramifications until the beginning of July. That's my thought process. I think most EPIs would agree that it sometimes takes that long to, get that data and see what the transmission's doing and see where the hospitalizations are going. But, we'll have to see. I mean, it's a complex scenario. There's a lot of businesses that are economically hurting, but it's a balancing act between public health and the economy, and no easy answer.
I think, John, that in the Dropbox, you gave us a document from Matt that specifically outlines the things towns can do and not. So I think actually it might be covered in there. And I think we can't, but I forget. I read the whole thing through, and I think we can be overruled by the state, is if I remember correctly, is what it said.
That was my assumption. I was sort of curious if, because John has counterparts all over the state, if there's some sort of like grassroots sort of movement to oppose it or not. But it sounds like no.
I haven't heard anything in that direction myself. And where, we have group emails and so forth with my peers and counterparts, colleagues. That hasn't been on the discussion table. I think everyone likes to see a uniform response if it makes sense, obviously. But again, it's interesting because not every town is the same. I mean, there's higher risk in densely populated city areas with subways and transits than there are in places like Millis. There's different dynamics at work, and one plan to say that it fits every situation is probably erroneous. But I guess the state's going to do the best they can do to make a generalized plan. But again, every city and town is different, demographics and density of population and everything in that direction that could influence what they determine is safe versus not safe.
Yeah, I remember at one of the press conferences that Governor Baker had this was 2 weeks ago, when the wearing masks was strongly mandated, strongly suggested. And he answered the question of why didn't he make an executive order about that? And he said, because I'm going to trust that each town, each municipality is going to take care of how they want to enforce this, if they want to impose fines, if they want to make it whatever. He said, because one size doesn't fit all. We're different. There's, like you were saying, John, there's different densities and there's different, protocols that, different towns might want to embrace. My guess is whatever he comes out with is going to be, like you said, there's going to be some things he has to, it's an all or nothing, like if the state says, this opens, then it has to open everywhere unless there's local, ordinance differently. But my sense is there is some discretion from town to town based on, you know, do you live in Chelsea or do you live in Millis? There's going to be very different protocols required, just, you know, to try to step out of, you know, shelter in place. So, and, you know, I think it's like the headlines change every day. It's going to be that, you know, it's like, take a small step and see what happens. Take a small step, see what happens. You know, with data being 3 or 4 weeks behind the process too. So.
Yeah. Well, just so you all know, in this, there are sites, the state's actually done a pretty good job with DPH giving the numbers and the data points on some of the key metrics, if you will. They have a dashboard that they put out every week or so, and that's on one of the state DPH sites. And it, you know, it's about a 30 or 40 page metric summary, and it's kind of interesting. You go through all the graphs and charts and gives you an idea what's going on, where we're at. So it'll be interesting to see as these plans, these phases roll out, how those metrics change, for the good or the bad, or if they don't change at all. So, you know, there is a baseline to a degree right now, to some degree. And maybe that's what they would, you know, they may want to see a stronger baseline. So who knows what they'll see on the 18th. But, you know, things are trending downward. So I guess that's, for now, it's positive.
Yeah, so Jack, are you considering like the requiring everyone wear masks all the time or something like that? Because
Well,
we have talked about it.
yeah, I mean, one of the things that I found really interesting about this article, and it's written by the person at Brigham who's in charge of you know, health and safety, and he, you know, he said we've got 5 pillars that we have kept 75,000 people able to work, except, you know, when they get sick, and then we're very good about putting them aside. We pay them to stay home. They log in. If they need a test, we follow that test. But he said everybody has a commitment to 5 pillars. One is, you know, hygiene, hygiene, hygiene. Second is mask at all times. Third is social/physical distancing. If he said when we go into situations where we have to be closer than 6, then we mandate the plexi shield. The fourth is everybody, before they get to pass that checkpoint, gets checked, have they logged in and put their symptoms, you know, they're clear of these 12 symptoms, possible symptoms. And if they're there and they checked one of those, like a sore throat, snuffy nose, we pull them aside. We say, please go home. We'll make sure you get paid, and keep logging in. And he said, and the fifth is 75,000 people agreed to do this together. And I found it a really impressive article because it didn't, you know, he said, you know, we're doing things based on science. We wear masks because, again, you know, 5 days, yes, but some days, some people it's 3, some people it's 10 in terms of symptom presentation. Some people don't think a stuffy nose is a symptom, and they, you know, and now it is. But I found it really a very useful article for how whatever the science is that in this case Brigham's is employing, they're using it consistently and uniformly. And I think that's the question is, you know, I mean, I know I get irritated with, you know, I've got to put a mask on. I got to wash my hands for like the 10th time before noon. But at this point, I've kind of gone over my speed bump about it, and I'm doing it because the alternative is worse for me. But I'm that person. You know, I have a strong science background, so I respect science. I embrace science. In terms of just, I can tell you from someone who's on a street watching people, the mask is not the norm in Millis. And, you know, it's again, I think that's where there's the cultural piece missing. But I don't know how you get a cultural piece when you don't have, if you're an employee of Brigham's, you've already agreed to do certain things, show up on time, stay your shift, yada, yada, yada. When you're working in a town, how do you get consensus on that cultural piece?
I don't,
And I think the mask at this point has become a symbol of something else, unfortunately.
I would disagree that Millis isn't wearing masks, but the key piece is where? Indoors. Now, outdoors, since we're further apart, I think requiring masks for everyone, especially if you're walking with the people you live with, that there's no scientific basis for that. So, and I think it's ironic, knowing the Brigham and knowing a lot of people that work at the Brigham, they weren't supplying equipment in the beginning. They weren't doing any of those things in the beginning. They've come a long way.
Right.
Yeah.
Yeah. I think everybody's learning curve has come a long way in the weeks. Yeah.
So I think for us, in terms of a Board of Health, I mean, I think the only issue that we need to think about is mandating masks when people go indoors to businesses, or John, you could probably share the town hall mask policy, which got developed. I think that's the question. And I have talked to the police chief about that, because the other big question about mandating masks when people are out in the street walking is, how do you enforce it and who enforces it? And we have talked to the police chief about that. And one of the ironic issues about this is, if you confront someone that you think should be wearing a mask, because, if they were closer to you, less than 6 feet, strictly speaking, for a minute, that doesn't count. It has to be 15 minutes. And as I said, that's the standard that hasn't changed. Now, in Boston, walking down the downtown, you're meeting a lot of different people in that 15 minutes. So, I mean, that's a different issue than walking by one person 4 feet away for a minute. So I think we have to carefully balance what's best, what we can actually accomplish. And the other thing is, you don't want to confront somebody about that if they're going to start yelling at you, because you just increase the viral load in your face. I mean, that's the reality. So it's, how do we navigate all this is the question. And I will say, I do go shopping. I will say I've been impressed with how many people in Millis wear masks indoors. I think
I have to agree, just to chime in, I have to agree that I see people wearing masks all the time in the town I live in. I think there's a culture right now of mask shaming, or, if you're not wearing a mask, people give you a look, and some people will comment at you, indoors. I haven't seen it outdoors, but I've seen it indoors already, where, people will give you a stare, and some people will comment and say, "Where's your mask?" So it's kind of self-policing to some degree. So it depends on the situation. And granted, there's some, they've got the exemptions for medical issues, things of that nature. It's hard to decipher now. You talk about HIPAA, someone says that they've got a medical issue. How you confront that situation if they're, I think in many ways it's, if you see a group of people, like kids, like congregating and none of them have masks on, that's the kind of situation you want to definitely confront head on and say, what's going on here? But as Kathy had mentioned before, so there are people who may be walking side by side without masks, and you say to yourself, okay, this is against the guidelines and the orders, but they could be from the same household. They could be husband and wife that live together, on a regular basis, obviously. So there's a lot of gray areas in this, and the enforcement end is very tricky. I know I've said this to Kathy in the past, that, this will come up again once the establishments start to open up, and, you have 30%, 50% capacity. In enforcing some of these regs, Board of Health, we can enforce the licenses on the establishment, but for individuals, Board of Health officers or health agents don't have the power, police powers to ask for IDs. We don't have that power. So, we can't go up to someone and say, you're in violation, what's your name and address? They can say, no, I'm not giving it to you. We don't have the power to demand that. So that's a very dicey issue as far as enforcement goes. But I'm, jumping ahead of things. Ultimately, I've seen my experience so far. A lot of people are wearing masks. Most people that I see on the streets and whatnot, and we'll get occasional calls from patrons that say, I went into such and such a store, and a employee wasn't wearing a mask, and we get on that right away. We're very keen to get on the employers, employees, and they're very responsive that I've seen.
And you have the authority to do that? You have the authority to then call that business and say your employees need to be wearing masks?
Oh yeah.
Because we permit them.
Absolutely. Especially if they're a food establishment. I mean, they're licensed because it's a mandated order now. You can't operate. That could be an issue. Fines would be probably secondary. It's can you still operate, endangering public health if your employees don't follow the orders? So, but knock on wood, we have seen many of those, and the ones that have come about, the owners are very quick to get that corrected.
Kathy, you said something about the police chief, and I'm curious where he is. I talked to him a couple weeks ago because I've got a stop sign that people blow through, and he was set to do some monitoring of that, and they've been hanging out. They were hanging out the end of my driveway, going after people. Actually found people with outstanding warrants, but he said, I'm going to stop doing this because I don't want to put my officers at risk. So the question I have, but again, I'm prefacing this with, this was 3 weeks ago, maybe. Where is he now with, because that's like John, you were saying, oh, there's the group of kids hanging out. Who's going to go, who has the authority to go over to them and say, hey, you really need to be wearing masks? Given that the police chief was like, we're not going to be those people. We're not going to go into people's faces, and we don't want people's faces in our faces with what's going on.
I think he would help us with egregious situations. He's been very good at working with us. And he's treating his force like that every person they encounter, they're at risk for, which is the way for him to do it.
Yeah,
so,
no, exactly.
So I think we're getting as much cooperation as we can based on the other situations that police have to deal with. I think, we just have to probably keep getting creative at ways to improve people's behaviors without putting anyone at risk. I think, because we permit a lot of businesses, like John said, it's very easy for us to get the employees protected. The one that John's been working at recently is, and I say April was, we were remembering frontline workers like postal workers and bus drivers and healthcare workers. I say mid-June is going to be when we remember a couple landscapers or contractors, because I would say that's the group that is, as you drive around, you're seeing the least amount of mask wearing. So certainly every time I see that, I drive John crazy because I call him. And I will say, if it's a new development or something that we have some control over, we've been able to, get them to wear masks. The one I think we have the least control of is landscapers. I've seen lots and lots of landscapers that, 4 guys coming out of the same truck and none of them have masks. So how we get that next group of workers to realize you know, how we get that information, because a lot of them are younger. They may feel they're healthy and it won't be a problem for them. And,
That's
you know, and I
exactly-
was thinking one of the new approaches we need to take is ask if they have young children. Because this
Mhm.
stuff that's coming out about the post-viral syndrome that kids are having is scary. But to me, that's a group of people we need to find a creative way to get them to realize that, you know, there are times when they need masks. But in terms, you know, Emily and I have talked about this. We all come with our personalities. Some of us are minimizers, some of us are in the middle, and some of us are maximizers. So we need to get the minimizers, like the landscape people, to realize their risk and change behavior. And we need to get the maximizers not to call us every time someone walks by them 4 feet away. You know, it's how do we get people in the middle? You know, get people closer to the middle for all of us, so that they do the behaviors that we know will protect them the most. It's going to be a challenge. Yeah.
Well, yeah, and I think, I mean, I had a big tree fall in that windstorm, so I had to have a landscape crew show up. It was only supposed to be one person, and then 2 people came. So I'm out there showing them where the tree is with the mask on. And they're, like you said, they jumped out of the truck, no masks. And when I said, would you guys like a mask? I've got some extras. They're like, no, because how can you smoke when you've got a mask on? and I was like, oh yeah. And they're, you know, 20 something. And that misnomer of, you know, if you're under 60, you're okay. It's just going to be a bad case of the flu is still out there for people who don't read, you know, every day. You know, they just hear whatever Fox News or CNN is telling them as the headline, maybe. But they're too busy. They don't really care. It's happening out there to those old people. And that's still very prevalent.
Yeah.
You know, so, and as like you said, Kathy, this is evolving. You know, now it's the 20 to 40-year-olds who are stroking out, you know, and now it's the children who, and, you know, it's you know, it's the nature of something novel. You don't know anything about it until enough time passes, and you can look backwards and put together patterns. So, but I'm glad to hear that there's some authority that the board has in terms of the businesses to kind of keep that minimum standard going with the employees at least.
I know if anyone here has any creative ways that we can get people to wear masks, we're all ears. When they should. Yeah.
Can we, for example, I know when Costco was one of the first businesses to require masks, and people are all up in arms. And one of the big, you know, supposedly reasons people minded is they didn't want to go out and buy masks, spend the money then, you know, that they'd already spent by having the membership at Costco. And Costco started just supplying. This was original. I don't know if they still are doing it. You know, had masks there for people to use who didn't have a mask if they walked in the front door. So my guess is, you know, people don't want to wear them sometimes for ideological reasons or lack of understanding the actual purpose of them. But the argument would also be, I'm not buying them, can't find them. I don't make a mask. I don't want to spend money on a mask. So then what do you do if that person's at the door of your establishment? You know, you can request a mask be used, but what if their pushback is, you know, I don't have one, and so are you gonna push me away from coming in the door?
I think for business they can.
Okay.
For business they can, and they have.
Okay.
And it's to their best interest to do that, because
yeah,
because other customers in the store won't want to be in the store with something if the store allows, or the business allows people to come in without masks. So I think because of the majority of us, you know, I think that isn't much of a problem around here.
okay.
I mean, I think one of the ironic things is, you know, the public health thing about no shirt, no shoes, that wasn't a
Yeah.
constitutional issue. And this one, which is much more important, no mask, I'm not sure why that one is. You know, that doesn't make any sense to me.
Yeah.
Yeah, I don't know if it's because one person I was speaking to last week, and I had never thought of it from this perspective, is in the beginning, we were told, don't wear masks, because they didn't want people to go buying equipment that could be used in hospitals. So I think people feel like we're just giving these mixed messages all the time. And, you know, people are really frustrated at this point. Kathy and I were talking about this the other day. I notice more frustration on phone calls and both with cases and with, you know, the state and whatnot. So when that person said that to me, I said, oh, I never really thought from that perspective. You know, we're giving all these messages and they're changing all the time. And don't buy this mask, buy this one. And I think some people are just frustrated at this point. And I also think what you said earlier, Jekar, about, you know, younger population, some still think this is not going to be it doesn't really affect my life. And that's
Right.
where yeah. So I don't know. I think, you know, cases that we've talked to, most people have masks. So, you know, if we hear people who really can't get one or don't have one, you know, we've been talking to those cases and helping them out. But yeah, it's hard. I think there's a level of frustration at this point amongst people, I think, maybe, I'm not sure. And it's a comfort thing too. Some people put the mask on for the first time and, you know, they hate it. They don't like the way, you know, and so I'm not going to wear that. But, you know, if you wear it a few times, then it becomes, you know, easier for some people. Other people have said that to me. I don't like the way I feel when I wear the mask. So I don't know. But I think most people we've talked to have masks, so that's positive.
And we do have some masks available, Jekar. So if people call and say they don't have a mask, we've been able to provide people with masks.
Okay.
Emily's mother is diligently sewing masks.
Yeah,
And
I think she's up to like 50 or so at this point. So
yeah,
and she's very concerned about the fabric and the patterns. So she found this old Red Sox pattern fabric she had because she felt like hers were all very floral, and so I'm keeping my mom very busy. So I have those, and we'll probably drop a bunch of those off at the food pantry and places like that. If people are coming in and they notice you don't have a mask, you know, can offer them. Yeah, so it's keeping her, since she's been sewing the masks, I've gotten far less texts and phone calls that I'm doing every day, so it benefits me too. I can. So she's yeah, it's a win-win for everyone, I think.
and we have been in contact with the seniors, with the Council on Aging, and there are people making masks there. So I think we haven't heard of anyone that needed a mask and didn't get one when they asked for one. So I don't think that's a major problem for Millis. Or if it is, we haven't heard about it yet.
Okay, great. This is slightly off topic, but I'm curious, in terms of the numbers in Millis of confirmed presumed positives, do they break down similar to what the national breakdown is in terms of age groups, percentage of people in different age groups?
I would say we've had quite a range, right, Kathy? I mean, I'm trying to think the youngest. Yeah. The youngest was in their teens, and it ranges all the way up to what, 85, 86.
Yeah.
I would say we have a strong group of 50 to 60-year-old females, and that goes back to what Kathy said. A lot of coming out of healthcare facilities, nurses and whatnot. So Yeah, I think we do have quite a range, actually, now that I kind of think about it in those terms. I hadn't really thought about that. Right, Kathy, as far, yeah.
It's too small a sample size to do much with, but we have a pretty broad range. And, you know, the contacts that we kind of really believe they had untested COVID, that range is even wider, you know. So yeah, I think we're pretty much on target with what you'd expect.
Mm-hmm.
So should we move on to other things? John wanted to give you guys a just let you know what else is going on at the Board of Health. Do you have any other questions for Emily?
Oh yeah, where are you having people tested mostly, or is it pretty broad range of places now?
So the testing now is still, I don't have the authority to send someone to a facility, which is, I hope, something that might come down. So right now, folks either get tested through their workplace or they call their primary care doctor and they get sent to Norwood Hospital, Milford Hospital, BI, so wherever their provider is. So yeah, that has come up on a few calls with public health nurses recently, because I can't say to someone like, go to, you know, Brigham and get tested. The urgent care facilities that are currently doing testing where you could potentially walk in, it still requires a bit of a referral and you have to be symptomatic. And so that someone has to have symptoms at this point. So yeah, it kind of ranges where they work or where their primary care doctor is or provider is filtering them over to.
So places of work have like a company nurse, for example, who's doing testing? I mean, when you say places of work, what is that?
So like if you work at Norwood Hospital, you could go down to the already set up, Norwood has their own setup place. Some of the other facilities, you know, Kathy, I'm not actually sure the answer to that. People who've been working at some of the long-term care facilities, I think they do the testing there, correct?
Yeah, the state had a push to test all long-term facilities and nursing homes. So, in that instance, in terms of workplace testing, it was either the National Guard or Fallon Ambulance Company does it. There's a whole bunch of, but that's if the employer chooses to call them in and have them do broad-based testing on their employees. For most other places of employment, it's really down to your primary, or if the job is requiring it, they would probably recommend you go to X place or Y place that they've essentially developed a contract with.
Right. Okay.
Yeah.
Okay.
So, you know, one of our issues is the latest about getting contacts tested. They actually came out and said you could go to a place and get a test with a Board of Health note. And it turns out that's not true. So we have to educate people and say, no, you still have to call your primary. If they, you know, if your primary is unwilling for some reason to give you a test, you know, call, you know, we just say, have the primary call us, or call us back and we'll call them. So that's where it is right now.
Yeah, because I'm with the BI system and they just put out an email today saying they cannot test unless you have X, Y, and Z symptoms still, which is maddening. But yeah, that I found that interesting because I figured they put that out just before whatever rolls out over the weekend with the you know, the May 18th changeover. They were basically saying don't come here thinking you can get tested unless you are, you know, basically pretty symptomatic. with, again, it had to be fever plus at least one other symptom. So, which makes no sense because the science isn't there, but that's where BI is.
I think we're all clearly getting mixed messages about that. We're being told you can get tested, and then when you actually try to get tested, you find out, depending on your situation, is
Right.
yeah, unfortunately that's happening everywhere.
Yeah, I figured as much, but
Yeah.
hope springs eternal.
All right, I didn't know, Kathy, it's up to you, obviously, if you wanted to. I know that Matt said he may have to be, feel free, Matt, if you have to be somewhere else. I know that you had mentioned that you were going to adjust the time to be on this meeting at 3, so I don't want to.
Yeah, I was going to say, I have a hard stop in 8 minutes, so I can
Okay.
hang on till 4:30, but that's okay.
I think we wanted to make you guys aware of what's been going on. And John sent you stuff. There are 2 proposed projects related to marijuana that are in the early phases. And that's in the Dropbox information that he left you. And the other thing is the election, just to remind you that it's 6/22, and to spread the word that they are encouraging mail-in voting. Yeah. And it says on the town website how to get a ballot. So, anything else, Emily?
No, I think that's it for me.
Yeah. John, did we cover all the big stuff?
Yeah, I think the big stuff's covered. Just to let you know, it's every day, and Emily knows, you might know as well, Kathy, there's either a Zoom meeting or a call meeting with the state almost every day, from either the health department, for the DPH, on Maven, on their emergency management division, or the local regional medical reserve corps for A and B. Again, it's probably at least 4 or 5 meetings a week, remote meetings, obviously, that deal with the issues. So there's a lot of information out there. In some ways, it's sensory overload, because it just keeps coming in, and sometimes you have to make heads or tails. You can't make heads or tails of what's changed and what hasn't changed. But it's good to have it than not have it, I guess. So I've been spending my days doing a lot of that. I field calls here and there for complaints that come in. Doing a lot of the contractor COVID protocols, which hopefully on the 18th we can relax those a little bit. Basically, just allow contractors to sign an affidavit, a statement of understanding that they understand the governor's protocols on safe practices in construction sites. Because it's very difficult to be everywhere at once, and it's one of those things, especially when other businesses start opening up. You have to triage things and determine what's a primary risk factor and what's not. It's just the nature of the situation we're in. Other than that, we'll be starting up perk tests and other things like that, which in my mind are minimal risk because it's outdoors, good airflow, keep the social distancing, and I think things will be fine in that direction. Get some vitamin D in the sun. So other than that, things are going okay for the most part. I'd like to again thank Emily and Kathy and the nurses for all the work they're doing, because it's just it's a daunting task to try to keep all those cases and the close contacts, and the other board members as well. I appreciate your time and being here today. Just to let you know, if Matt seemed very technical in his nature in his questions, he is a virologist. So probably Emily's like, what's he talking about? RNA, and how does he know? He's a virologist.
Okay.
If you don't mind, saying so, Matt. So
No, and I asked too
we're
many
lucky to have
questions too, so it's a bad combo.
No, never too many
but
questions.
No,
No.
Matt, I'm hoping you get that info for us and you let us know what.
Yeah, I'm gonna look into some of it.
Yeah.
Please.
Yeah, that would be great because you could probably decipher the papers a lot better than I absolutely could. So it boggles our mind on a daily basis. So
yeah, there's a lot of stuff coming out everywhere you look.
yeah.
And it's tough to decide what's good science versus bad science.
I
so
just saw actually today in Science that I think there have been 56,000 papers published already on this,
Oh my gosh.
which is just insane. In fact, someone has put together a bioinformatics package to network all of the papers together so you can sort of see what's worth looking at and what's not. There's a lot out there.
Yeah.
Yeah.
Yeah. So
John, before we finished, so did you get a formal request about extending the perk season or not?
yeah. So I got an email from Dan Merricken from Legacy requesting that the board consider extending the perk season 45 days. I mentioned to him that it was too late to vote on this meeting because the agenda was already posted, but the June meeting is definitely possible because the perk season ends on the 30th for new construction. So obviously, the last couple months, builders, contractors, so forth, engineers haven't been able to utilize that that time period. So I guess the idea is to extend it 45 days from May 30th, or whenever the board sees fit. Because our regulations, our local regs are more stringent, and there's a perk season for new construction.
So John, have you actually gotten any applications?
No.
So in order for us to think about this as a board, because we'd need to decide as a board, it would be helpful to see if you could get some idea of how big an issue this is. Are there actually any new construction planned?
I would say that there was one engineering firm that inquired about it as well a couple of days ago. But again, it's like, they still have the ability to the 30th,
Right.
18th to the 30th to do perks. I guess the assumption is for a lot of firms is that they assumed, and I say that, in quotes, you're not supposed to assume, but the assumption was that most towns were putting those off until after, a period of time when the risk had gone down. So towns that have this restriction, they're looking to see if they can get that extension. So I guess the answer to the question, no, we didn't get any real formal requests for new construction perks that were refused, but the implication is that the engineering firms assumed that they weren't going to be able to do the perks. But
We haven't been not perking, right?
correct.
We haven't. So could you maybe hopefully get us some more information about if that is really a necessity or not before we make a decision?
Yeah, again, it's I'm trying to, I know that at least from one engineer, but probably two engineers and their firms, that they're saying that they would like to see that. I guess I could poll half a dozen or so engineering firms in the area and say, get back to me and let me know your thoughts on how an extension, is it necessary at this point? My guess is they'll all say yes.
But I think we need to say yes with data, we need to know how many actual projects do they have in the pipeline. So even just talking to the two people that contacted you, because in order for us to make a decision about this, we should have some numbers.
Yeah, I could ask them for actual numbers and say within a 45-day period, how many new construction that you couldn't conceivably get done in the regular
in the next
period.
2 weeks. Yeah.
that you would need to be able to do, you know, in a time period that would be, you know, part of the extension, that you
Okay.
could get done in the 2 months of, you know, shutdown. So
Okay. That would be helpful.
I would argue that if these people think that this is an issue, they should have reached out to you by now. It's not really our responsibility to.
yeah, this was only like I said, with,
And then we could have a conversation, you know.
yeah, no, I hear what you're saying. It's only within the last week that this has even been brought up. So, you know, one would think the demand wasn't there.
So
Still
you'll
good to have
just,
an opinion ahead of time,
yeah.
just in case.
Yeah, I wouldn't be in favor of extending it unless there's a really compelling argument for it. And again, if you have a compelling argument, then I would have thought they would have been making contact before now for that compelling argument. You know, I'm happy to be dissuaded otherwise, but that's where my current set point is.
How do I unmute this?
So we have someone that wants to speak.
I think is that Tom? Tom, are you there?
Yeah, I don't know. Can you guys hear me?
Yep.
Yeah.
Oh,
We got-
okay. Yeah, so I do have a couple spots that we're trying to perk, and to the other gentleman's, what he just mentioned there about, you know, he doesn't understand why we didn't before. Well, the same reason why most people haven't done anything in the last 2 months. All right. If we're not able to work, go in the town, there's so many reasons why. So I don't think it's acceptable to ask you to extend this because we just haven't had time to do anything. And a lot of guys in the construction business, you know, they're behind schedule. So that's the reason that I believe at least Dan asked you to see if we could do this extension. You know, it's not just that you just go into a property and, you know, there's a lot of things to coordinate to do this. So I would hope the board would give an extension, just like, you know, with the situation, everybody else has got, you know, some sort of leeway on things. So that's the way I feel.
Let me just add that can you introduce yourself, Tom? So for the record, for meeting minutes.
Oh, sure. Tom Roach, Roach Building Company, 270 Exchange Street, Millis, Mass.
Thank you.
So Tom, while we have you, can you give us an idea of essentially the extent of the problem for you? How many perk tests are you anticipating you might need to do?
Well, myself, it's just one property, maybe like 3 or 4 perk tests.
Okay, that's helpful.
Yep.
And
Well, let me ask you a quick question though, Tom, just while you're here. Do you think you could get it in before the 30th, or is it?
It's going to be very difficult, John, only because, like I say, we got to line things up in the property. There's different people that we're dealing with, different parties in order to get us permission to do that. We have been trying, but again, with this COVID situation, it's hard to get anybody on the same page, you know, to meet. Never mind, you know, it's just very difficult. And I think too, you said, John, too, that like Millis is more stringent than the state, not only on this, but on a few different things that I plan on coming in front of the board, particularly how they shut off the perks in Millis at 30 minutes. I think that's way outdated. You know, I'm going to wait a little while to come into the board to request that being changed. We've heard from the Charles River District people at different selectmen's meetings that they want us to get off the sewer system now. It's like a total reversal, but that's another matter. But I just wanted to bring up how Millis is more stringent than the state on a lot of aspects. So hopefully you can, you know, we're just asking for 45 days to try to catch up to what we're trying to do. That's all. And that's all I have to say, unless you have questions.
Thank you.
Thank you.
Thanks, Tom.
Yep.
So, John, when would you be thinking about having another meeting?
I think it would be June 8th,
Is that a Monday?
Monday, yeah.
But should we do it on a Monday since the selectmen?
Well, that's a good question. If assuming that we're still doing remote, which is probably foreseeable, it's up to you. If Thursdays at 3 work, that's great. If there's other times that'll work better for people, that's great.
I think, Matt,
Yeah.
what hours are you available?
When is that again?
I can't do Thursdays, John. I'm going back to work at my other job.
For a June meeting, like the week of the 8th in June, what day and time is good for people?
Currently, I have Mondays and Wednesdays open. I can be somewhat flexible depending on what's going on. That being said, there are times that meetings, because I'm working full-time still, there are times that meetings come up even last minute that I cannot get out of. So I'll be as flexible as I can, but sometimes it might be difficult. But I'll also let you know of that as soon as I know. Anyway, so to answer that, am I even on mute? No, okay. So 8, 10, 11 would work for me.
John, how about the Monday that the selectmen aren't meeting?
Yeah, that's a good question. I'm not sure what day, if it's the 8th or the 15th. But yeah, what I'll do is I'll do the Monday that they're not meeting. It's a good idea, and just try to plan for that.
Okay, and then hopefully by then, if we'll have some idea if we need to extend the perk season, actually how many actual numbers we're looking at. You know, with actual data.
Yeah, like I said, I can call half dozen or so in firms around the area and say, okay, what perks have you not done in the last 2 months for new construction that were planned?
Yeah.
And see what their answer is.
Okay. So should I make them, so anything else? Any other issues? Should I make a motion to end the meeting? Okay. I make a motion, we end the Board of Health meeting for May 14th. I have to pull the board. Jaikar,
I'm sorry, yes.
Okay. Matt,
Yes.
and Kathleen Lannon, yes. So we're all set. And John, you'll email us a date in Monday in June that works best? Okay.
Yes.
Okay. Did I forget anything else?
I think so.
All righty.
Oh, actually, just meeting minutes, if you want to review those, they're on the Dropbox for March, February and March.
Yeah, we could approve them at the next meeting.
At the next meeting.
Yeah.
Okay.
Since first, thank you, Emily.
Thank
Thank
you.
you,
Thank you. Nice to meet everyone. Okay. Bye. Thank you.
See you later. Thank you.
Bye.
Karen, we're all done. In case she doesn't know.